Good evening, everyone. Warm welcome to the fourth day of Oral Cancer E-Conclave organized by ICanCaRe Sterling Cancer Hospital and FHNO, Foundation for Head and Neck Oncology. We are on the fourth day. In the last three sessions, we have had prolific discussions about challenges of diagnosing an oral lesion, about the early oral cancers, about locally advanced cancers. We saw about the treatment. We saw how beautifully the panel discussion gave solutions to very challenging cases. And here we are today on the fourth session where we're going to discuss and talk about the rehabilitation and follow-up of the oral cancer patients.
And I invite the chairperson for our next session, none other than Dr. Somesh Chandra. And again, Dr. Somesh Chandra needs no introduction to this gathering. He is the director, Sterling Cancer Hospital. And the speaker for our session is Dr. Pawan Gupta. Everybody meeting, I don't think Dr. Pawan Gupta requires any introduction. Just to complete the formality, the director, head and neck at Max, and he is the man behind ICanCaRe. And over to Chandra.
Good evening, everyone. Thank you, Dr. Meenu. Dr. Pawan is, we all know, the champion crusader. And without much ado, I mean, we all know him for the last 4 weeks, his dynamism and his fire to carry on with this campaign. And without much ado, I would invite Dr. Pawan to start his presentation.
Thanks for the kind introduction, and it has been a great 4 weeks, and I had to take the place of Dr. Pankaj Chaturvedi, who was supposed to speak today because he was busy with the COVID scenario that is happening in Bombay. So to put things here about tobacco cessation and specifically when it concerns the head and neck surgeons. There is a large number of trade people are required from making this tobacco a social acceptable custom to a social outrage, and focus on tobacco alone, as we have just seen. Dr. Vikram had also elucidated to the fact that tobacco is a very major factor, and this is the main evil for all oral cancers. Almost 90% of the cancers that we see of the oral cavity is related to tobacco. So we need to be really working together to make it really a social outrage and make it a successful program with all the head and neck surgeons, and it should be part of their curriculum and part of their practice as well. So importance for a successful program is that there has to be a capability that is skill up to intervene and not be just a quack when it comes to tobacco intervention. So that implies the doctor needs to be, the head and neck surgeon needs to be capable and needs to be skilled in helping people to help in tobacco intervention and tobacco cessation. And there has to be an availability in all the hospitals. If whether it is a big institutions or even a small practice, tobacco cessation should be part of the treatment. And so whenever the person or a oral cancer patient comes in, if we do not work or do not tell about tobacco cessation, the work is incomplete. And visibility, that is, increases the visibility of the practicing doctor. The tobacco users are encouraged to quit tobacco. If we have more and more people talking about tobacco cessation, definitely there will be more and more people who would be ready, who need to quit tobacco, would be able to come to the center. So this is something that is required, and of course a network of social workers, network of doctors in and around your place of practice, so that more and more people can be sent to the center and we can help these people quit tobacco. So this is the ABCD of tobacco cessation. I have tried to make it as simple as possible, and ICanCaRe, we have worked hard and we have worked for many years to make tobacco cessation available and easy for each one of them, each one of you who is listening to us, and we have been training a lot of doctors across India. So what is ABCD of tobacco cessation? The number one, and for a successful program, number and the foremost is active follow-up and keep up the motivation. This is something very important. The person needs to be regularly followed up, and that needs to be taken care by the whole team. And then the second most important is the behavior challenge, that is the habit modification, that is the behavioral therapy that we need to put in. Then the third very important is the comorbidity management, because these patients, as we have seen, would have a lot of mineral deficiencies, bony pain, constipation, fatigue, cough, and lot many other things that would be associated with tobacco. And when this person quits tobacco, all these things basically comes forward and comes in place, and the person starts feeling that these are the some of the withdrawal symptoms. If we can take care of all this, then probably this patient will be easier for them to quit tobacco. And the last and the most important is the drugs, that is the medications that is required to manage the withdrawal symptoms, to manage the nicotine challenge that the patient is having. So these are the three very important, the will that decides what type of intervention we need to give, the willpower index, the addiction index, and the components of addiction that is there. So what we have done, because there is the tobacco addiction, initially when I started my medical as a cancer surgeon, it was very easy, because I just needed to tell them, please you quit tobacco. But I thought that the person would have quit tobacco, but that never actually happened. What we actually needed was a certain protocol based and a systematic insight and a systematic assessment. As I had said, the willpower index, the addiction index, the components, and then that needs to be totally worked out for each patient, and then the therapy needs to be instituted for these patients, which will give them the best results for tobacco cessation. So what we did at ICanCaRe, we made this ICanCaRe Wellness app, which is the world's first tobacco wellness app, and it is made in India, and it is basically to empower each one of us so that it becomes easy for us to help people to quit tobacco. So this whole app was designed by Rishabh Agarwal, and he's a BTech, MTech from IIT Kharagpur, and he's the director at ICanCaRe. And I would just request if we can say a few lines about his app that is really helping a lot of people across India to help people quit tobacco. Rishabh, if you are there, then please say a few things about this app.
Thank you so much, Dr. Pawan. This app has been wonderfully designed and made available freely on the Google Play Store for the patients, for the tobacco users, to seek assistance from the network of tobacco cessation specialists, where they can seek the right protocol-based treatment in a very scientific manner and overcome the habit of tobacco, incorporating all the components that we all just learned about, the ABCD of tobacco cessation. It's all incorporated into the applications. So I'll request everyone to please make the maximum use of it, to reach out to more and more people and get the maximum benefit out of it. Thank you so much.
Thanks, Rishabh. So tobacco intervention with technology, that is what we are looking at. And this is what has been made very easy. What we have started is a virtual clinic system. And we have got the quit coaches and the quit buddies who support this tobacco cessation program. As I said, the most important for a successful tobacco cessation is a proper follow-up and to keep up the motivation. So this is how we are working. And this app, which is available, has got, and the whole tobacco cessation, it consists of the app, the digitalized protocol-based treatment, equipped tobacco wellness center, training. This is the most important, or the backbone of the everything, that proper training that is required, the self-help materials that may be required for this people, e-pharmacy. What we have created, a e-pharmacy where we can send out the patients all the medication that is required, because sometimes the medicines may not be available locally. Then the quit coach support that is always there, and the central quit line number. This is a unique thing that has happened, and this is the only tobacco quit helpline number, which is a private number. There is a government number also, but this is the private number where we are using this extensively, and we ask every person around who can just call this number, and we will help this person. And community network model, this is again a very important aspect. So for this assessment, we have got this Fagelstorm level of dependency, and there is a Fagelstorm scoring system on which basis we divide the patient into low, medium, and high, and dependency on tobacco. And then there are the three components that is we assess on this app, that is whether the patient is a social component, the physical component, or the psychological component. Which of this component is more stronger, and that needs to be addressed accordingly. So this app actually helps in patients getting means the whole system assessment, and based on this assessment, that is the quantitative assessment, then we do the screening, then we do the behavioral counseling, then the pharmacotherapy, and of course these patients are followed up on a long-term basis. So medications, supplements, nutrition, comorbidity management is the most important aspect that we need to give to these patients, and these are some of the medications and some of the interventions that is given for the nicotine, the physical aspects of the for therapy, that is the nicotine gums, the nicotine patches, the lozenges, and the most important that has been introduced right now is the varenicline, which is a specific medications for tobacco cessation. It is an alpha 4 beta 2 receptor agonist, partial agonist, and it helps control both the withdrawal symptoms as well as the cravings for these patients. And then the comorbidity, we have got to add a lot of certain supplements to these patients, like lycopenes, which has to be at least 16 milligram. Normally the lycopenes which is available is hardly 4 milligrams or 6 milligrams and sometimes 8 milligrams, but we have to give approximately 16 milligram of lycopene, then immunity boosters, then calcium, and this is a very important medication that we have developed at ICanCaRe, that is ELC, which is vitamin E, L-carnitine, calcium, vitamin D, and zinc, 5-in-1. And this L-carnitine, actually when the patient stops taking tobacco, he has a lot of fatigue, he has feeling of bony pain, malaise, so this takes care of most of the thing. And then of course the vitamin C and zinc and the curcumin that is given to these patients. So this for the behavioral therapy, there is the 7D methodologies, and this methodologies actually incorporates all the aspects. This is the again a unique way how ICanCaRe works for these patients, the unique methods. And this 7D is basically plenty of water, deep breathing exercise, delay, distract, diet, discuss, and drug. These are actually in itself. So we have got a YouTube channel where we have put this thing there, and a lot of people who wants to know more can go to that. Withdrawal symptom management is key factor for successful tobacco quitting, and every person will have different types of withdrawal symptoms. There are 13 withdrawal symptoms which have been documented, and there may be some more which a person may have, and each withdrawal symptoms is unique for that person, and that needs to be taken care as we follow up these patients. On the first day we assess the patients, we start the treatment, and then as on the second follow-up day, that may be on the third day or the seventh day, we assess what were the withdrawal symptoms, and then the medications are instituted accordingly. So submucosal fibrosis is another very important factor that we take care for these patients, because without taking care, these are small conditions that also needs to be taken care as we are tobacco, as we are the head and neck surgeons. And when we talk about oral cavity, this is a very common thing that we see with our patients. So submucosal fibrosis, and we introduce this TrisCare, which is a very unique instrument which helps to open up the mouth, and we can keep on increasing the mouth opening, and we have been getting a lot of good results with this TrisCare. And this Curage gargle, actually we added this Curage gargle, and this Curage gargle is basically, it has got curcumin, sodium chloride, sodium bicarbonate, and E-Gelia, which helps both in decreasing the bacteria in the oral cavity, as well as it helps in increasing the elasticity of the for these patients who have got submucosal fibrosis. So this instrument is only 850 as compared to others which are available in the market, and we are making it available to all our colleagues so that they can use it for the patients. So when we talk about tobacco wellness program, it is a very much a balanced approach, when we have this pharmacotherapy, the behavioral intervention, withdrawal symptoms management, and this associated illness management, immunity. And this is what is called, it has to be a personalized treatment, and it ICanCaRe digitalized protocol based treatment which help the person get the best out of it. And that is where we got 92% quit rate as compared to 4%, which is the overall quit rate all over the world. So tobacco cessation is something that I specifically say, a lot of people are available everywhere, plenty available next door, on the road, every party you can see that people will be talking about tobacco cessation. It's very easy, it can be done. The person may be smoking, chewing himself, but ready to guide others. A medical specialist is also a quack unless trained in tobacco cessation. Quacks makes the little life difficult and force the person to believe the impossibility of quitting. This is what I specifically tell, if one needs to be trained specifically And then if a person goes to them, and if certified tobacco cessation intervention specialist, definitely there is the results. So what does a certified tobacco cessation specialist does? He is trained on motivational counseling, performs protocol based intervention, prescribes adequate medications, and provides full support. That is A, B, C, D of tobacco cessation is given by this patient, and we can ensure 92% quit rate. So we at Max Hospital, we started this tobacco wellness center. This is the first such center in any of the corporates, and we collaborated with Max, and we opened this in last year, and we have been working extensively, and this is how it has been working at tobacco cessation clinic. And we have got every aspect. A screening room is there, and then we have got the oral prophylaxis consultations, and then these are the aspects that we are taking care in the tobacco cessation clinic, and that is oral screening, oral prophylaxis, tobacco cessation, and oral rehabilitation. Needless to say, all these four things are the very important pillars for a better outcome for our oral or the king of oral cancers, the king of all cancers. If we can do this, and if we can set up such a thing in your hospital, in your place, and if we can perform all these four things, definitely the outcome is going to change the whole oral cancers in our what we see. So tobacco cessation, most people do not plan to fail, but most fail to plan, and it's the clinician responsibility. Clinicians have a professional obligation to address tobacco use and can have an important role in helping patients plan for their quit attempts. This is very important, and this responsibility, it is inconsistent to provide healthcare and at the same time remain silent or inactive about a major health risk. Tobacco cessation is an important component of therapy, and specifically when we, as the oral cancers, the dental surgeons, and oral rehabilitation who are working in this is a must for everyone. So need of the hour is the manpower. We need to have a lot of people working with us. So we have divided into various programs like tobacco marshals, who can be teachers, PICUs, security, police and MSS, tobacco ambassadors, the paramedics, and the tobacco specialists, who can be the doctors. And a huge army is required actually if you want to control this tobacco. And we have got almost 26 crore people are taking tobacco, and 20 lakh new entrants to tobacco use every year, 5,500 per day, 13 lakhs dying every year because of tobacco in India. And with so many children taking up into addiction, we need each one of us have to be part of it. So this is the ladder program that we have started, and building up manpower, skill up, visibility and network. And we started this ICanCaRe Academy under Dr. Reena, who is the director for this academy. And we have been training skilled professionals and we have been endorsed by Gujarat University and for these courses. So this is an accredited course by the Gujarat University, the first such course in India for tobacco cessation, and we are looking for partnering and collaborating and training as many doctors, as many head and neck people, so that this is available each and every corner of India. So we have the volunteers, the marshals, the ambassadors, and the specialists, and this is what I have said, and this is how the network is there. So specialists at the top with the marshals, tobacco ambassadors, and volunteers, and this is what we look for. We want to train, have at least 1 lakh tobacco marshals, 40,000 ambassadors, and 20,000 tobacco specialists all across India, and then only probably we will be able to do that. We have developed many volunteers already. So these are what we are looking for, and this is where we look forward for all your participation. So that is for those people who are looking for opportunities. For the dental people, there is a huge opportunity, and an investment by any hospital or can definitely change the whole protocol. Training in place, we have got each and everything in place, so we can help you out in setting up the centers. So role of a doctor has be spread, do not start to quit tobacco, be careful and fearful, never to take tobacco themselves and not be in company of anyone taking tobacco, set example, become role model, and also make it socially unacceptable. It is moral responsibility of a doctor to address the tobacco issues of a patient. What best a doctor can do is ask about the tobacco history, advise the client to quit tobacco, and refer the client to a certified specialist. And we have got, so we want to recognize the fact that tobacco is a disease. You are as much prone as anyone else. No one is immune from being affected. Recognize the fact that there is a need for help for these tobacco people who are taking tobacco. They will not be able to quit just by telling them to quit. We need to provide them the help, the assistance that is required. Please do not take help from quacks. Even if you are there will be very much high specialist, a recognized doctor, but until as he is trained in tobacco cessation, he is pointed out as a quack, not as a specialist for tobacco cessation, and that he makes the job of tobacco or successful tobacco cessation very difficult. So tobacco cessation intervention is a specialist job. This is what I highlight and this is what I say. And if you want an easy option, yes, we are there. Become an alliance partners, because a lot of you might not be able to do a tobacco cessation. So we have provided a very systematic way, and we are giving this ICanCaRe virtual tobacco cessation program, which we are launching it very shortly, and network program with partners being part of it, like you all can be partner. And we have this national ICanCaRe quit line. Any patient just can log into this, call up this number, and we will get in touch with them and will help through their local, because we have now have more than 500 doctors across India and across every state. So we will be able to help in their own language to these patients. So this is what is the power of ICanCaRe and the app that we have developed. So I just, last but not the least, I say be careful and fearful of the people taking tobacco around you. And this is what I send a message to everyone. Refuse to take tobacco, refuse to be a friend of a tobacco user, refuse to marry a tobacco user, refuse to employ a tobacco user, refuse to work with a tobacco user. So that is where I said be careful and fearful, because second and third hand effects of tobacco are there. So we have got our the community page on the Facebook. We have got the blogs where we keep on putting a lot of articles. I'll request everyone to join on the blogs. And we have got the YouTube where we have got a lot of videos for the patients to understand, the Instagram page, and we are there at all Quora and other places. And I can invite you to become one of the authors for this for our page. So I thank you very much for the patient listening, and I'm sure all of you will take advantage of this the system that we have developed and help your patients get the best out of it. Thank you so much.
Thank you, Dr. Pawan. That was again indeed very enlightening. In spite of knowing you so well for so many years, I mean, every time I listen to you, I'm amazed at the amount of work as an individual, as ICanCaRe, as a group, what all is already being done and what more that can be achieved. I'll request everybody to be a part of this program and contribute their little bit, whatever we can do. And next, again, before we conclude, I'll request Dr. Somesh Chandra to give the concluding remarks.
Thank you, Dr. Pawan, for a very comprehensive coverage of the topic. You have made it amply clear that it is a science. It cannot be practiced as a sidestep kind of a procedure. And you need a very motivated counselor and worker to really make a dent and motivate a patient and a user. Dr. Mayuri had a query about how to deal with the insurance aspects of such people. I believe we'll be taking up all the questions at the end of all the lectures. So please take a note and address that issue. Thank you.
Yeah, thank you so much. Surely we will take up this question in the end. Thank you.